Hello, I am Dr. Venkataram Mysore, Dermatologist, Hair Transplant Surgeon, Venkat Center for Aesthetic Health, Vanashankari, Vijayanagar, Cunningham Road, Bengaluru. I am here to talk about certain new aspects of hair transplantation which have been developed in recent times. Now, in hair transplantation currently, the most common method of extraction done is follicular unit extraction. This can be done from the occipital scalp, it can be done from the facial hair, beard hair, it can also from the chest hair, sometimes abdomen, pubic hair, etc. In some ways, FUE has been the most significant advance in recent times because it has expanded the donor area. It has also made the procedure less invasive, so healing is faster, pain is less, and patients are very comfortable even on the day of the surgery. Now, within this FUE, there have been several advances. One is in instrumentation, second is in techniques, third is in technology. In instrumentation, we have new types of punches, we have new types of motors, and we have improvements which enable us to take long hair or what is called non-shaven FUE. One of the things in the existing methods is that the hair has to be trimmed to 2 to 3 millimeters. Now, with new types of punches and new types of motors, what is called oscillatory movement with artificial intelligence, we have machines which can help us to extract hairs without having to shave the donor area, so that patient doesn't have to alter the look. This is one recent field which is very exciting. Still, there are some glitches in that. Transaction rate is a bit high, procedure is a bit slow, but it is rapidly improving. Now, techniques, the conventional techniques have continued, but new types of instruments have also emerged. For example, we have published a paper which rationalizes the depth of the hole or recipient site, direction, and the shape of the blade that has to be used for this. As you can see in this video, this was published by us recently. We now know what exactly has to be the depth, angle, direction, etc. Likewise, coronal slits, we have shown it recently to be of significant benefit in putting what are called perpendicular grafts, which enable the graft to spread apart a little bit and prevent light from going through and create a better appearance of density. There is one thing which I have to caution here though. There is a tendency amongst some doctors to highlight small little advances as if they are great technological marvels. So, a little different material, little different type of punch, they give it a name. Bio FUE when you use PRP. PRP is a standard process. Bio Accelerated FUE again for PRP. PRP is a standard process which is done by everybody. DHI Direct Hair Transplantation is a standard method which everybody does. Sapphire FUE. Sapphire is a material used for punches. They are a little refined. The inner diameter is much wider without having to increase the size of the punch, and that is advertised as Sapphire FUE. We purists and classicists like me, those who have started a long back, discourage such tendencies to exaggerate small things to make it appear as if it's a special type of FUE. No, it is not a special type of FUE. It is a slight modification. And remember, in science, there are different processes to achieve the same result. Ultimately, it is the skill of the surgeon which does most of these things. Now, one real advance that has happened is the robotic hair transplantation. There is one true robotic which is Artas from USA, but currently it is so expensive that if I were to get it in India and do it, I would have to charge something like 500 to 600 rupees per graft as opposed to 60 to 70 rupees per graft that we are charging. So, it is impractical for our patients. There are many other robotic machines with artificial intelligence which claim to be robots. They are not really robots, but they are advertised as robots. So, I would caution people who look at those things to study them properly before resorting to that kind of techniques. Now, there is another advance which has happened recently. That is with drugs. Oral Minoxidil tablet has become available. Low dose oral minoxidil in the dosage of 1.5 to 5 milligram. This is in place of topical minoxidil which used to cause itching, which used to cause dryness, shedding, headache, powdery scales, messy hair, etc. This is far more pleasant. It is not still a first drug, but anybody who does not tolerate topical minoxidil, low dose minoxidil is a real good advance and it is well tolerated. we are using it. We are also trying to see whether it will make the growth of hair faster after hair transplantation. Another new advance is what is called scalp auto micrografts or hair follicle induced derived growth factors and stem cells. Now it's a common knowledge that the hair on the occipital area does not shed, does not get lost. It is permanent hair, it is androgen resistant hair. That is because they have certain cells which are absent in these cells, in these hairs here. So one method takes about 8 to 10 hairs here, process it in a small centrifuge like machine, create small micrografts out of it, and the mechanical process releases the cells and growth factors. You get an extract which you can inject into the balding scalp. You can mix it with PRP if you wish. That's what we do. And this has been shown to be giving results almost up to about 6 months to 1 year. PRP has to be given every month. This can be done once in 6 months or a year. So this is again a recent advance, still undergoing evaluation, but potential advance. Now, the other advance that has happened recently is in the use of lasers. Several types of lasers have been shown to be effective for growth of hair. One which we are using is erbium laser in a special mode called smooth mode. We use it and we have found some very good results with it, as these photographs show you. This is just the use of laser which is painless. There are no injections like PRP. There are no pain during procedure or after the procedure, and the patient is extremely comfortable. And 4 sessions, once in 2 weeks, this kind of result can be achieved. Likewise, there is another laser, 625-75 nanometer laser, which has also been introduced now. So this is one more significant advance in the field of hair transplantation. So with all this, what has happened is that hair transplantation, hair restoration is becoming easier to manage. You now have medical treatments, drugs. You also have regenerative treatment like PRP and autografts. You also have energy devices like lasers, and you have hair transplantation. And finally, what is the recovery after transplantation? After transplantation, recovery is extremely smooth because of FUE. Patient can go to work the next day. He can look normal the next day with a cap on. There is no prohibition on wearing a cap. Patient has to take a diet which is rich in proteins, supplements which contain vitamins, minerals, etc. In this, I would like to tell you that we have promoted and we follow what is called combinational and rotational therapy at our center. This is the paper we have published, as you can see here. Here we use nutrition, we use lifestyle modifications, drugs, regenerative treatments, devices and surgery as it is needed, sometimes in combination, sometimes in rotation, to minimize the side effects and maximize the benefits. For example, people are afraid of taking finasteride. What we have done? We give finasteride for 3 months, stop it for 1 month, so that body flushes out the accumulated finasteride. And during that 1 month, to avoid any hair loss, we introduce PRP. So this kind of combinations help you to get the maximum benefit out of the different treatments and also minimize the side effect. Protein is a very important factor for hair. What you see, the black shaft here, is entirely protein. Many people in India are vegetarians. Vegetarian food, high quality protein may not be available. And more importantly, many young people stay as bachelors. They stay in paying guests, they stay in hostels, they themselves stay by room, they may have to cook themselves, they may not be able to eat at all proper times, they may eat whatever is available. In such a situation, balanced diet will not be there. So supplements of vitamins, minerals, vitamin D, iron, everything is very important. And that we emphasize through this paper called rotational therapy. So this in brief is a note on recent advances in hair transplantation. One final word of caution, of late we are seeing a new phenomenon. People are reporting to us with thinning at a younger and younger age. I have seen 16-year-olds with thinning, 18-year-olds with early baldness. This is part of what is called a metabolic syndrome. These people are often obese, they put on weight rapidly, they may get diabetes and blood pressure later. They also have family history of diabetes, blood pressure, stroke, heart disease, etc. So, proper health, exercise, avoidance of smoking, avoiding stress, all are very important. So, this needs holistic, wholesome management. That is why we have advocated combinational and rotational therapy at Venkat Center for Aesthetic Health. I hope you have liked this video. Please send us your feedbacks. Thank you very much.